I'm here with Dr. Syed Hussein of Trinity Health of New England, and it is time for our Health Matters this week. Good morning.
Good morning.
Now, first up, I want to talk about Connecticut recently becoming the first state to have a designated liver health day. So I'm sure there's a lot of significance of this day. Why is it important for people to keep tabs on their liver health?
Yeah, so let's talk about this. Extremely important organ, right, in the body. And for optimum health, good health, you need to make sure you have a good liver as well, just like some of the other organs in the body. So there are a few pillars that viewers need to keep in mind that ultimately lead to a good, healthy liver. Liver that is chronically damaged over a period of time can lead to certain outcomes that are not good, such as cirrhosis of the liver, for instance, with chronic inflammation. So let's talk about things that will protect the liver. So first and foremost is your diet. So we have a lot of ultra-processed foods, a lot of unhealthy eating habits. So making sure we have healthy habits equates to hopefully a better liver in terms of good health. Making sure that you have antioxidants and green leafy vegetables, all the good things that we've spoken about previously as well matters for the liver. Making sure you have cut down on your alcohol consumption, because that can ultimately, all of these things put together can lead to a condition known as non-alcoholic fatty liver disease, which can progress, by the way. And usually it's very asymptomatic, which means patients may not experience any symptoms till later on. So making sure you cut down on your alcohol consumption is important. Making sure you deal with stress in a way where either you meditate or you have some, recreational activities that you can participate in to reduce that stress. All of these taken together are important factors. What are some red flags to look out for? So if you have weight gain, especially around the belly, if you have fatigue, if you have yellowed eyes, jaundice, for instance, all of these things are warning signs. But make sure you have your annual follow-up visit with your primary care doctor, because there's certain blood tests that can be done also to assess how the liver is doing and how you are in terms of your fat content in your body as well.
Okay, good deal. And the next one I know is affecting a lot of folks out there, allergies. So if you think your allergies are particularly bad this season, you may not be making it up. So doctor, is there some truth to this? And why is it so much worse?
Yeah, let's talk about this as well. So it's the season, but however, most viewers will agree to this, that we've had quite a few warmer days than usual over the last couple of weeks. So that leads to plants blooming earlier than usual. Plants get a little confused, and which means they will release more pollen than usual at this time of year. So, which all equates to more allergies. 1 in 3 Americans will have some degree of allergy symptoms they will experience. So maybe sneezing, itchy, watery eyes, cough. So if you fit into that category, make sure you have a plan. Make sure, especially when you're outdoors, if you have underlying asthma, for instance, and pollen and this season can exacerbate those symptoms, make sure you have your inhaler with you when you're going out. If you're indoors, make sure your HVAC filters have been replaced. Use a HEPA filter, for instance. So there are things that we can do in addition to making sure, like I said, your meds are there, handily available should you experience any symptoms, especially when it comes to breathing.
Yes. Now, is there a certain point when someone should maybe go beyond over-the-counter medications and see an allergist?
If you talk to your primary care doctor first, depending on the duration of your symptoms and severity of your symptoms, especially when it comes to breathing difficulties, then yes, definitely seek medical attention.
All right. And lastly, I've been seeing a ton of videos about anti-inflammatory diets on my social media feeds, and a lot of people are trying them, saying that it's helped with their body, the way they feel, helped them lose weight. Is there any truth to that? And can you break down how it's beneficial?
Yeah, let's talk about this as well. So we know chronic inflammation is the foundation for a lot of different diseases. So diabetes, heart disease, cancer, arthritis, all have a bedrock foundation of chronic inflammation. And so reducing that inflammation doesn't necessarily mean you have to take pills or medication. There's things you can do to improve your diet, for instance. There are things in the grocery store that you can make sure are included in your daily diet. So by that I mean green leafy vegetables, fruits such as strawberries and oranges, things that may have more antioxidant, anti-inflammatory properties to tamp down some of these inflammatory effects. Fish, for instance, olive oil. Your typical Mediterranean diet, by definition, will fit into that category.
Okay, good to know. And I know there's a ton of those recipes and cookbooks to help folks adhere to those
And
guidelines.
less, if I could add,
Okay.
Symphony, less ultra-processed food too.
Less. I guess that's always good all
Yes,
around. Huh?
yes. More healthy, more natural eating
Okay.
is always good.
All right, there you have it. Thank you so much for joining us.
Thanks for having me.
Back to you.